This is Radio Health Journal. I'm Nancy Benson. This week, dog bites.
Don't come out saying I think pit bulls are like AK-47s, but I would also say that there is some inherent danger when you have a dog as part of your family that is fairly strong that could have some aggressive behavior when prompted.
The cold, hard facts on dog breeds and dog bites when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
This week on Viewpoints.
15 years ago, no one had a cell phone, and now it's like 96% of the population have one.
Teaching kids how to live responsibly in the era of everything digital. Then,
yes, honey, that person has beautiful brown skin, and we don't point at people. That's not polite.
The importance of discussing race and diversity early on. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Close to 40% of American homes have a dog, and the dog population in the United States is an estimated 83 million. They're man's best friend and America's number one pet. But sometimes dogs aren't so friendly.
Almost 50% of all children will be bitten by a dog at some point. Now, that doesn't mean that they need to seek health care. Some of these bites are pretty minor, or that are abrasions that are just taken care of, at home, by the family, and don't require anything in addition. But we certainly, our institution, see some pretty serious injuries. And so from that standpoint, it is not an uncommon thing for us to get called for a dog bite that requires surgery.
That's Dr. Charles Elmoraghi, Chief of Pediatric Otolaryngology at Nationwide Children's Hospital in Columbus, Ohio, and Associate Professor of Otolaryngology at The Ohio State University College of Medicine. He says that according to CDC estimates, nearly 5 million people a year in the United States are bitten by dogs, and 20% of them need medical care.
For adults, it's going to be kind of their legs and lower extremities or their hands. For children, we see it in the head and neck fairly commonly because, again, that's kind of the level of where the dog is. If you have a 2-year-old that comes up to a mid-sized dog, they're going kind of face-to-face with them. So that's why we see a lot of facial injuries with pediatric patients. And again, they're the age group that's most at risk because that age 2 to 4. The injuries that we see, it's the full gamut, again, from simple puncture wounds to lacerations, tears. We see tissue loss. Sometimes there is tissue gone that we have to do more reconstructive surgery. In the face and in the head and neck, there are critical structures such as the eyeballs, the ears, the salivary glands, there's nerves, there's arteries. All of those things are at risk.
Elmoraghi says young children are not only at the right height for a potentially serious dog bite, they're also most at risk to be bitten in the first place.
Toddlers experience the world by a lot of feel and a lot of stimulation. Like I have a 2-year-old daughter. When I hold her, she'll poke me in the eye and she'll smack me in the head, and that's just her way of exploring the world. And that's how toddlers interact with dogs for the most part. Even the family dog, that they just don't have they're not at a developmental stage to know how to handle an animal. And dogs are territorial. If you wake up a dog that's sleeping, if you're interrupting a dog while they're feeding, they definitely get very defensive with that. And a child doesn't know, like a toddler's not going to be aware not to do those things. And that's usually when dogs bite, meaning dogs usually are provoked when to bite. They don't usually randomly bite a child. And I think that's where toddlers are not able to read the signals and signs that a dog is going to bite them or a dog may be getting aggressive.
Fortunately, most dog bites are minor and don't require medical care. But more of them require a visit to the doctor than you might think.
If it's perforated the skin or punctured the skin and you've got significant bleeding, because again, dogs' teeth can penetrate fairly deep. So if you've got a deeper injury where it's punctured through the skin and it's more than an abrasion, it's probably worth at least seeing your primary care doctor. But again, if there's an actual cut or laceration that needs stitches, then obviously it needs to be seen. It needs to be washed out thoroughly, and you need to be on antibiotics as well, just because just like a human mouth, a dog mouth is not very clean.
Some dog breeds have a reputation for biting, but are those reputations deserved? El-Moraghi and his colleagues reviewed 15 years of trauma cases at 2 hospital systems and did an extensive literature search to find out. They evaluated which dogs bite the most often and which leave the most damage when they do.
Definitely the frequency of dog bites, we definitely saw pit bulls come out as the top dog as far as frequency of dog bites, and they also had the most severe dog bites as well. Now, mixed breed was number 2, and that's common just because, again, a lot of dogs are not, a lot of dogs that people have in their house are a mixed breed, and so it was really no surprise with that as well.
Among mixed breeds, dogs weighing between 66 and 100 pounds who have wide, short heads are most likely to leave a severe bite. There weren't a lot of surprises.
German Shepherd came out as third with regards to kind of increased risk of biting. Like Labrador Retriever has not a high frequency of biting, but a pretty significant bite severity because they actually do fit that description of kind of short, square heads, and they can sometimes get, fairly large as well. Great Danes were one that they rarely bite, but again, a Great Dane is a very large dog, so if you do get bit by a Great Dane, again, the chance of having a more severe dog bite is higher. And again, it makes sense, Jack Russell Terriers they bite a lot, but their bite severity is low. So we found stuff that would make sense. But again, we weren't seeing, these are dog bites that presented to a hospital, so it's already kind of self-selective for a higher degree of severity. So there weren't people coming to the hospital with Yorkie bites.
Pit bulls are controversial to own, and most municipal breed-specific bans single them out. Until 1998, the Centers for Disease Control tabulated fatal dog attacks by breed, and pit bulls were far ahead of any other. But the American Pit Bull Foundation says the problem isn't with pit bulls, it's with people. El-Moraghi says he's well aware of owners who say their pit bull would never hurt anyone, so they say the study must be false.
I have pit bull owners in the room I'm actually speaking in right now that are, I think, glaring at me with regards to this study. But yeah, so we have definitely pit bull owners, and we've definitely had a reaction from that group of people that own pit bulls. But again, it's not a matter of, so the way that research is done is it's not like we have one experience saying, well, my pit bull would never bite somebody, therefore pit bulls would never bite anybody on this earth. You can't really extrapolate one experience to the whole population. That's why we do research. So, and the data is the data, and this is not just our study. These are other studies published in the literature that we were looking at, and it was all consistent, meaning that it's not a matter of, again, my analogy is like Legos. So are Legos all bad? No. But have children under a year choked on a Lego before? Yes. And so again, you have to be careful with regards to anything that you choose to introduce into your life that has some risk. You have to decide risk versus benefit.
El-Moraghi says having a dog like a pit bull, especially if you have children, is like having a gun in the house.
A gun in the right hand, someone that knows how to handle a gun, it's probably not as dangerous, but if you introduce guns with people that are not aware of how to handle a gun, then certainly something could happen. And again, don't come out saying I think pit bulls are like AK-47s, but I would also say that there is some inherent danger when you have a dog as part of your family that is fairly strong, that could have some aggressive behavior when prompted.
El-Moraghi says he likes dogs and had dogs at home at one time, but now he has a 2-year-old and an infant. He's waiting to get another dog until the kids are 8 or 9. You can find out more about this subject and all our guests on our new website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Healthy bones are the foundation for lifelong vitality, but too often, bone health is something we worry about only for women. In fact, 1 in 4 men over age 50 will break a bone due to osteoporosis. But research is showing that men can support healthy bones with wholesome and delicious California prunes. Nutrients that support bone health, including boron, potassium, and vitamin K, are found in California prunes. Dr. Shireen Hushman of San Diego State University is one of the nation's leading bone health researchers.
Studies have shown that prunes are beneficial to bone health among postmenopausal women. Now, recent research in men ages 50 to 79 shows prunes benefit them as well. Men who eat 100 grams of prunes daily over 6 months receive similar bone protective benefits in terms of slowing bone breakdown as measured by changes in bone biomarkers.
California prunes are the perfect snack. Enjoy them after exercise, on the go, or add them to salads and cereal. Find out more at californiaprunes.org.
2 new studies show that sensory impairment, such as hearing or vision loss, is connected to dementia risk. One of the studies, presented at the Alzheimer's Association International Conference in Los Angeles, shows that either a vision or hearing deficit increases the risk of developing dementia by 10% or more, and that impairment in both senses increases the odds much higher. Dr. Keith Fargo is Director of Scientific Programs and Outreach at the Alzheimer's Association.
Through these new research findings, we are beginning to learn that sensory impairments may also be associated with the increased risk of dementia, especially when there are several of them at the same time. But we need more research to see if correcting the sensory impairments can reduce dementia risk.
A second study looking at combined effects of the loss of smell, touch, vision, and hearing shows that even mild impairment in multiple senses is associated with an increased risk of dementia. Find out more at alz.org.
With the summer break gear tucked away for the season and new school backpacks at the ready, it's time to be thinking about serving up tasty, healthy meals and snacks for those on-the-go, activity-filled days of fall. Including foods that kids love to eat, like fresh grapes, makes it easier. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
Stock your kitchen with foods that are easy to eat, that travel well and can serve multiple functions, such as hummus, whole grain crackers, cheese, fruits, and veggies. For example, heart-healthy grapes can be tossed into yogurt or a breakfast smoothie, packed into lunches or into sports bags for a fresh, hydrating snack. A bowl of grapes can serve as an easy side dish to a simple dinner of soup and sandwiches.
Grapes from California are a natural source of antioxidants and other polyphenols. With just 90 calories for a 3/4 cup serving, no fat or cholesterol, and virtually no sodium, fresh grapes are a smart choice. Visit grapesfromcalifornia.com for more information.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.
Coming up next week on Radio Health Journal.
I felt like a zombie. For 8 years, I stayed on antidepressants, hoping that one of them would help. And unfortunately, none of them did.
Copper overload, a commonly unrecognized cause of depression and anxiety.
Then, history's worst plagues and how we respond or don't respond to them.
In the AIDS epidemic, we got very good at demonizing people who were afflicted with an illness.
All that and more on Radio Health Journal.